started at exactly 2.7 mLs of sterile water. Once you reconcentrate it, you have to look, and if it's a different color, you don't want to give it. Usually it turns purple when it's no good. If you happen to get busy before you can give it IV, it can only stand out for 4 hours. After that, you have to throw it away and get a new vial. Anything that's unused, you go ahead and discard that vial, and of course it's only supposed to be given a one-time draw. It can't be reused.
Okay, so Paul, if you're going to choose warfarin, there are some additional things you need to know. For instance, if you want to take her out for a nice dinner, there are some things that will definitely take the hot right out of her trot. So, if you want to take her to the foods she cannot stand because of her vitamin K content, are asparagus, cauliflower, beans, broccoli, Brussels sprouts, cabbage, collards, green tea, kale, milk, mustard greens, spinach, Swiss chard, turnips, yogurt, V8 juice, high protein boost, and beef country liver. And of course, cranberry juice and products. I know what you're thinking, Paul. Maybe a little crazy partying after dinner, but no can do. Warfarin is not a big fan of alcohol, other prescription drugs, over-the-counter drugs, or herbal products like peanut, garlic, ginger, ginkgo, onion, sweet clover, and turmeric, especially those containing aspirin or NSAIDs. As a matter of fact, food, drug, and alternative therapy interactions are more frequent in warfarin than any other prescription drugs. However, we have all seen warfarin have a little sassy side, so you'll need to talk to your doctor if you experience bleeding gums, nosebleeds, unusual bruising, tarry black stools, blood in the urine, diarrhea, pain, color or temperature change in the area of your body. Oh yeah, and of course there's a little possible hair loss. But anyway, you also need to keep up with frequent lab tests, because we all know how warfarin likes to get around in your body, of course. Because I'm talking about INR to see how fast your blood is clotting. And I can see that maybe you're having second thoughts, but here are some ways to keep you safe while you're out with this lovely gal. You want to avoid intramuscular injections, use a soft toothbrush, don't floss, and shave with an electric razor, and avoid activity leading to injury. And also keep in mind that injection sites require application pressure to prevent bleeding or bruise formation. And if you're going to have any surgery or dental procedures, talk to your doctor before then.
Wonderful, ladies. Very informative. Let's have a round of applause for these two. Okay, Rachel, you and I will then take one to you, heparin.
Okay. Before I administer heparin to my patient, I want to ask myself 6 different things, and I want to look her over. Is she the right drug for my patient? How will she be getting under his skin? Is she the right amount of drug for him? Is this the right time for my patient? Is my patient the right patient for this drug? And last but not least, not to be too overbearing, I want to write down the time and way of administration just to keep track. Last but not least, I will look her up and down before. You want to invert the bag if you're doing a heparin drip at least 6 times because it can settle. And you want to check the APTT and make sure she has no allergies or the patient has no allergies to the drug. The APTT is usually 20 to 45 seconds is the normal range. And I want to flush before. At the same time, I'm going to be checking who my patient is, what the allergies are. Flush before I start the drip. Thank you. Flush before, connect, wet it in the pump, and then when she's done with the drip, throughout the drip, we're going to be checking. I passed you guys a protocol that I got from work, and it tells you when to draw and what to do with the results of the PTT. For a sub-Q injection, we're going to want to go in the belly fat area. Definitely going to want to go where the iliac crests are. I'm going to have this for you, lovely lady. Not really. It's just going to go in the fat areas. And when I give heparin, I always try to go over there to no bruising, because usually they will have bruising from previous injections. And that's it. Okay. Paul,
You say heparin was fat?
if you're going to take out heparin, a few things you need to know. Don't take heparin and ask the doctor if you want it to be or for products. Tell your doctor before taking out any new medications, including those you find elsewhere. Several over-the-counter medications, including Advil, Motrin, Aleve, or aspirin, can increase the risk of side effects or interfere with the way heparin works with you. If you're planning a medical or dental procedure, tell your doctor or your dentist that you're taking heparin. Now, Paul, take heparin out at the same time every day. If you forget to take her out as soon as you remember, unless it's close to your next scheduled date. In that case, just skip the one you missed and show up for your next scheduled date. Notify your doctor immediately if you have a severe headache, dizziness, confusion, difficulty speaking, or uncontrolled bleeding. You should also tell your doctor if you have frequent bruising, orange or pink urine, tarry stools, or vomit that looks like coffee grounds. Use a soft toothbrush and an electric razor to prevent bleeding. Use mouthwash instead of floss and avoid toothpaste. Use a humidifier during the dry months to prevent nosebleeds. And don't forget to keep all your scheduled doctor and lab appointments. Okay, ladies and gentlemen, let's have a round of applause for Rachel. Well, now's the time, Paul. You've heard their stories, and now you must choose. Which of these beautiful medications will you take out tonight? Will it be the endearing and enduring warfarin, or will it be the spontaneous and daring heparin? Tell me, Paul, what is your choice?
This is so hard. I absolutely love heparin's self or instant gratification and her need to be injected. Then again, Coumadin and her oral commitment kind of gets me right there. Can I have both?
Ladies and gentlemen, Paul wants double trouble. What do you think, ladies? Are you up for it? Can you share?
I guess.
Paul, it looks like a win for everyone. You must start by taking out heparin. And when you're ready to switch, you must start dating warfarin 4 to 5 days before you're done dating heparin. Join the INR at regular intervals. Also, you must get a sample INR after the last date with heparin, 4 hours after the continuous infusion, 5 hours after the last bolus, or 24 hours after the last sub-Q injection. And don't forget, Paul, to watch for bleeding or tissue necrosis. Well, that's it, folks. Looks like these three are all winners today at the Coagulation Connection. Let's have a round of applause. That's all for today, ladies and gentlemen. Tune in next week when our new eligible bachelor tries to find just the right clotting factor to meet his hemophiliac needs. Until next time, thank you.
My back hurts now.
It's okay.
Yeah. My back is killing me now. Well, she received a phone call. It was like 14 minutes. Oh, wow. Yeah. Yeah, so they made the 14 minutes on it because she had a phone call in the middle of it, so it's not the video. She needs to tell Joan she's in school. Who is Joan? Who is Joan? Tell her she put up my video. Oh, she never calls me. Well, she just